your scalp. Okay, so I'm going to touch you here. All right. So I'm looking for here for any occult lesions, anything that I might not have been able to see with my initial examination, but everything seems okay. So I'm going to go ahead and move on to the next part of the exam, which is the visual component of the exam. Okay. So first, with this particular eye chart, I'm going to be 14 inches away from you. This might vary depending on what eye chart I'm actually using. But for today, I'm going to ask you to read the smallest line that you're able to read. Okay. First cover one eye. Now tell me which line you can read.
The second to last one below.
Can you read the numbers there for me, please?
Yeah, 4, 1, and then 20 over 25.
Okay, great. And then now with your other eye, can you read the letters this time of the lowest line that you're able to read?
3, 1 plus, and 20 over 20.
Okay, good. Okay. Next, I'm going to go ahead and inspect your conjunctiva. Okay, so I'm going to have to touch you again. All right. And here, I don't see any signs of any redness or lesion, and as well as the other visual component of this exam. I don't see any signs of jaundice. Your eyes appear to be reactive and symmetrical in terms of their movements. Okay, so next I'm going to go ahead and do an examination of your pupillary response. Okay, so first I'm going to do the normal pupillary response as well as the consensual in your other eye. Okay, and while I'm doing this, I'm just going to just look straight at that Purell sign over there. Okay, so again, in your left eye this time, normal, and then consensual. Okay, very good. Next, I'm going to check the right eye. Not with this, with my otoscope. Good. Okay, now I'm gonna make sure that your eyes are responding correctly, giving the red eye response in both eyes. And they do, very good. Next, I'm going to go ahead and check your retinas. Okay, so if you don't mind, again, just keep on staring directly ahead of that Purell and come in from is the right side. So I'm coming in from my right side. Getting a good look and focusing as I go in closer and closer. Okay, very good. And then again on your left-hand side. All right. Okay, very good. Now I'm just going to do a quick examination of your lacrimal glands. Okay, so this time you can relax a little bit. I'm just going to do a quick visual inspection first, and seeing there, I don't see any signs of swelling or any sort of signs of inflammation, such as redness or any sign of lesions and everything like that. So then next I'm going to go ahead and palpate. Okay. Is there any pain as I do this? No? Okay, very good. So next we're going to move on to the auditory component of the exam. All right. So first of all, I'm just going to do a quick visual examination of your ears. So I'm looking at structures such as the tragus as well as the pinna, external pinna. And from that, I don't see any signs of any exudate or lesions, rashes, bumps, or anything of the sort. Next, I'm just going to palpate your tragus. Okay. Is there any pain as I do that? No? Okay, very good. And I'm going to do a quick examination of your ear canal. Okay. Make sure that stays in. Okay. So I'm pulling the ear back towards me and back, and while I'm doing this, I'm inspecting the tympanic membrane. Okay. So this on both ears. Okay. So next I'm going to do a quick sort of rough examination of your hearing. Oop. There you go. Also something I forgot with the eyes. I'm just going to ask you to track my finger as I move it. Okay. So just keep your eyes on my finger. Okay, very good. Now, if you don't mind covering one eye, I'm just going to test your visual fields. Okay, so I'm going to hold up a number, either 1, 2, or 5, and you're going to, while looking directly at me, tell me what number you see. Okay, so
5, 2, 1, 1.
Okay, very good. Now with your other eye. Okay. with your auditory examination, I'm gonna do the finger rub test. Okay, so if you don't mind, when I rub my fingers, tell me which side you hear the rubbing on. Okay.
On my right side.
Very good.
My left side.
Good. Okay, now I'm going to go ahead and conduct the Rene and Weber test. Okay. So I'm just going to ask you to tell me when you can't hear the noise. Okay.
I can't.
Okay. How about now?
I can't.
Okay. That was Weber test. Now I'm going to do the Rene test. Can you hear this? Okay.
It stopped.
Okay. How about now?
I can hear.
And this? Okay. Again on the other side.
It stopped.
Okay. How about now?
I can hear.
And this?
I can hear.
Okay, so next I'm just going to do an examination of your oral cavity, aka your mouth. Okay, so first of all, just by visual inspection, I don't see any signs of cuts, lesions, any sort of redness or anything else that might indicate inflammation or anything, or any sign of dehydration such as dry lips. Okay, so next I'm going to go ahead and grab some gloves. It's going to feel a little bit like being in the dentist, but trust me, it's going to be fine. I hate the dentist too. Okay. So, let me go ahead and grab a tongue depressor over here. Do we have any in this room? That's better. Okay. So first one, I'm just going to ask you to open your mouth for me, please. Okay. Now, I'm checking, I'm going to check your pharynx. So when I say so, can you just say, Okay. Just get like a light so I can see a little bit better. Okay, open your mouth. And then one last time, say ah for me, please. Okay, very good. And then can you just keep your mouth open while you're doing this? I'm just going to inspect the roof of your mouth, your cheeks. And do you mind lifting up your tongue like this? Very good. So I'm checking the underside of your tongue now. And now I'm just going to check your gums. Okay, and while I'm doing this, I'm looking for any signs of lesion, any sort of white exudates or any signs of inflammation, but seeing none, I'm going to go ahead and conclude that portion of the exam. I conclude now. The next portion of the exam is the nasal aspect of the exam. Okay, so I'm just going to again take a quick look visually. Your nose seems good and symmetric. I don't see any signs of any lesions or rashes or anything of the sort. Have you been experiencing? Have you had a flu or anything like that recently?
No.
No. Okay. So next, I'm going to go ahead and take a look at your nasal septum. Okay. So again, I'm just going to go in. So if you don't mind, just lean your head just back a little bit. Okay. Very good. Okay. So now I'm checking for any nasal septum deviations, in addition to any tears or holes that might have occurred there. Okay. Very good. Now for the final part of the exam, I'm going to go ahead and do a quick examination of your throat. Okay. So first of all, just by looking, I'm looking for any signs of tracheal deviation, but I don't see any, as well as I don't see any signs of rashes or any inflammation of that sort. Okay. So I'm actually going to try to get a handle of your thyroid gland. Okay. So it should be right below your cricoid cartilage, which is about there. Here-ish. Okay, so now I'm just going to put my hands like this. Okay, I'm just going to ask you to swallow for me, please. Okay, I was able to feel your...
That was the thyroid cartilage.
Oh.
I think that you were on.
Oh, and I think that concludes the exam. So do you have any questions for me? No? Okay, great. I'm going to take this information to the final part of the exam. I'm just going to show how to examine the lymph nodes of the head. Okay? So first we're going to start with the occipital. So if you don't mind, I'm going to go ahead and reach around you, okay? So the occipital node behind the skull, and the postauricular, preauricular, tonsillar, submandibular, submental, the cervical chain, which has both a medial and lateral component, as well as the, I'm just going to have to reach a little bit through this, okay? As well as the supraclavicular nodes, but I don't feel anything. So there's no signs of fadenopathy. Great.
I'm going to begin by inspecting your scalp. Okay, I'm looking for any lumps, humps, anything of that sort. Any pain at all?
No.
Okay, scalp looks dry within normal limits. Okay, and if you'll remove your glasses for me. Okay, I'm just going to take a look here at your eyebrows. Face looks symmetrical. No abnormalities noted. Any pain at all when I press on your sinuses?
No.
No. Okay. Okay, I'm going to go ahead and begin by inspecting your eyes. Okay, just take a look straight at my nose for me. Perfect. Pupils are equal, round, and reactive. Okay, go ahead and take a look at my nose. And take a look at the light. Perfect, okay? Go ahead, and without moving your head, take a look at the light. Okay, and then we're going to do this side. Perfect. Okay, and I'm just going to look to the side. If you'll just look straight ahead for me. Okay, and no red reflex noted. Perfect. Any eye pain at all?
No.
Okay, your lacrimal glands, they look fine. Okay, we're going to move on to the nose. I'm just going to take a look in. Nares look pain, mucous membranes look moist, pink. Okay. Any concerns at all with your nose? No issues sneezing or anything of that sort?
No.
Okay, perfect. I'm gonna go ahead and inspect your mouth. Okay, can you say ah? Go ahead and stick your tongue out. Move your tongue left to right. Okay, teeth look natural. No dentures at all? Okay, perfect. I'm going to go ahead and elicit your gag reflex, okay? So it can be a little uncomfortable, but just bear with me, okay? Go ahead and stick your tongue out and say, ah. Ah. Perfect. Good job. Okay, I'm going to go ahead and take a feel of your throat. We'll look at your ears as well. Any pain right here?
No.
Okay, let's go ahead and look at your ears. Okay, because you're over the age of 18, I'm going to take your pinna and pull back and up. Okay, tympanic membrane looks pearly, grayish, no obstructions noted. Okay, auricle on the ear looks fine, no abnormalities noted. Any issues at all regarding your ears?
No.
Okay, we're going to do the same thing here. Auricle looks within normal limits, and let's take a look. Let's look up and back. Okay, perfect. Again, tympanic membrane does not look reddened. No swelling noted. Doesn't look like it's bulging or anything of that sort. Perfect. Thank you. Take your cover off. Okay, and last but not least, we're going to go ahead and take a listen to your throat. And before I do, go ahead and swallow. Any pain when you're swallowing? Okay, go ahead and open your mouth and bite down. Okay, no crepiness noted. Okay, I'm going to take a listen to your thyroid. See if I hear any bruits. All right. And trachea seems to be midline. Okay, I'm just going to feel for thrills on both sides of your carotid artery. Okay. Perfect.
Her head looks symmetric. When I evaluate her head, I'm checking for any areas of tenderness, any lesions or masses or crepitus. I don't feel anything like that. So then I'm going to look at her scalp, looking for any kind of dermatitis. Does she have any nits or lice or any kind of lesions on the scalp? Do the same thing on the other side. And she has normal texture of her hair. Everything looks good. Now, to check the ears, you want to just look at them externally, and they are positioned appropriately and normal shape. She has one piercing. I want to look behind the ears. That's a common place where you might have dermatitis or other abnormalities. I want to press on the mastoid and see if she has any tenderness there. And then movement of the pinna and the tragus will help give me some sense if she might have a swimmer's ear. Okay, do you have any problems with your jaw popping or giving you pain when you open it wide or when you chew? Sometimes. Okay. I'm just going to check that right now. Any discomfort when I'm palpating here?
No.
Okay. And can you open your mouth real wide and then close it again? Okay. Did that hurt at all?
No.
And I didn't feel any popping at this time, and appears to have full range of motion. So when using the otoscope, it is helpful to hold it like a pencil so that you can stabilize against the patient in case they jerk or move, so that you don't injure their ear. And if you have trouble seeing the tympanic membrane, once you're past the hair, you probably just need to tug harder on the ear or adjust it this way as opposed to pushing it in a lot farther, because it can be very sensitive and painful when you do that. For the otoscopic exam with an adult, you want to hold on to the pinna and pull up and back to straighten out the canal. And then you want to stabilize with your pinky and insert the speculum before you move in to look for the tympanic membrane. Okay, and her membrane looks gray, her canal is not swollen, there's no exudate, there's no bulging of the TM, and she has a good light reflex. For the left side, the technique is largely the same. I still keep the otoscope in my right hand, and then I stabilize against the back of the head, insert the otoscope, and then move in to look. Some people do switch hands, and that's fine too. I'm just not as dexterous with my left, but it's the same technique. You insert it, pull back, and then move in. Okay. To test for movement of the tympanic membrane, you need to use an insufflator. So insert the speculum, and then you're going to look while applying a little bit of external air, puff of air, to see if the tympanic membrane will move. The alternative approach to that is to look while the patient holds their nose and blows gently. And you should be able to see the tympanic membrane move. To evaluate hearing, you want to put your fingers about 4 inches from the ears and then ask the patient to close their eyes so they don't have any secondary clues by seeing peripheral movement, and then just rub your fingers together and ask them where they hear it.
Left. Both. Right.
Okay, that's one technique. The second technique is to whisper, and for this you need to be about 2 feet away. Ask the patient to close their eyes again and tell you what you said. 42.
42.
29.
29.
For the nasal exam, you want to look at the external nose, and in her case, she's got a little crease from allergy from doing the allergic salute, which she had reported earlier. Also has some allergic shiners underneath the eyes from chronic allergies. Notice if there's any masses or lesions or discharge. It appears to be normal size and shape. Then I want to check the sinuses. I don't see any inflammation over the maxillary or frontal sinuses. I want to palpate under the maxillary bone, under the frontal bones on each side to see if there's tenderness that would be associated with a sinusitis. Then want to look in the nares. You can just have the patient tilt their head back a little bit and lift up, and you can notice if there's any deviation of the most distal part of the nose when doing that before inserting the nasal speculum. For the nasal exam, you want to change out your nasal speculum. You want to stabilize against the face again so you don't hurt your patient. Lift up a little bit and just insert the speculum far enough to get past the hairs in the nose, and then you can look inside, moving it around slightly. When looking inside the nose, you're looking at the nasal turbinates for the color, noticing if there's any septal defect, any discharge, any inflammation, the color of the mucosa, all of those things. Okay, and then you would do that on the other side as well. First, when inspecting the mouth, you want to look at the lips. Notice that they're symmetric. There's no erythema, no edema, no surface abnormalities or leukoplakia, no lesions or ulcerations. Then you need a light source. It can be a pen light or your otoscope light, and you want to look inside the mouth. Open up real wide, look at the tongue, ask them to stick your tongue out, please. And you notice that it's midline, there's no fasciculations. She does have a fissure down the middle, but normal variation. Okay, you can put that back in. There are 3 salivary glands, the parotid, the submandibular, and the sublingual gland. The parotid is right at the angle of the jaw, and it drains through the Stenson's duct into the buccal mucosa about at the level of the 2nd upper molar. The sublingual gland drains underneath the tongue into the Wharton's duct. For palpation, the parotid and the submandibular glands can be palpated externally. The parotid will occlude the angle of the jaw when it's significantly enlarged. The sublingual gland is best palpated with a bimanual approach under the tongue and externally. Let me see your teeth. Okay, and then open your mouth. You want to look at the upper and lower molars. Notice if there's any caries that you're aware of. Then you need a tongue depressor to look inside the buccal mucosa, look for any kind of lesions, look for Stenson's duct, check on both sides. Okay, do you mind pulling your lower lip down? Okay, looking for lesions in here, and then pull your upper lip up. Good. If your patient has dentures, to do a good oral exam, you really need to ask them to take out their dentures.
Do not have dentures.
Yeah. Notice that. That was good. Okay. And then you want to look underneath the tongue. You also want to look for the Wharton's ducts, which are little papilla right there. And behind her lower teeth, you can see these 2 variations, normal variations called torre mandibulares, which are bony outcroppings with no clinical significance. To check for dental occlusion, you can ask your patient to open their mouth and then bite on a tongue depressor, and then open again, bite down. Okay. To check for dental tenderness, open up and just tap the teeth to see if there's any pain. Looking in the posterior pharynx at those structures, you ask the patient to open their mouth wide. You want to look at the hard palate and then a soft palate behind it. Then you want to look in the back at the posterior pharynx, the tonsillar pillars, tonsils if they're present. Ask the patient to say ah.
Ah.
definitely have to have a light. If you have difficulty seeing those structures, you can press down gently with a tongue depressor and again ask the patient to say ah. And I'm noticing there's no cobblestoning. I don't see any tonsils. The uvula is normal. The color of the posterior pharynx is pink. Everything looks normal. To palpate the sublingual gland is a bimanual technique. Could you open your mouth? You put your finger underneath her tongue and palpate here and on that side. And then if there was a lesion, you can feel the buccal mucosa. You can also check the gingiva to see if there's any tenderness. You should look at it as well to see if there's erythema or tenderness with that. Okay, if there was a lesion on the tongue that you were concerned about, you may need to palpate it. Although this is not part of the checklist, just wanted to demonstrate how to do that. Could you stick your tongue out so you can grab onto the tongue with gauze so that then you can palpate over any area of concern. Okay. When inspecting the neck, I want to look for symmetry, swelling, any kind of deformity. There's no tracheal deviation, there's no webbing or scars of any kind. To check for range of motion, could you just follow my lead? Look down, look up, look to the right, and to the left, and then put your ear to your shoulder and ear to your shoulder. Okay, and then I want to palpate the parotid gland here, submandibular gland, the sternocleidomastoid, and trapezius muscles. I don't notice any masses, lumps, tenderness, swelling, or issues of any kind. It can be difficult to identify and palpate the thyroid gland. It helps to think about the anatomy and start by palpating the notch of the thyroid cartilage. Below that is the cricoid cartilage, and below that will be the isthmus of the thyroid. For the thyroid exam, first you want to just inspect and notice if there's any swelling or deformity or asymmetry, which I do not see. Ask your patient to swallow. Okay, and we're looking, well, you want to feel the thyroid, the notch of the thyroid cartilage, and then the cricoid cartilage, and then the thyroid is down here. I usually do my exam from behind. And so again, I'm checking for thyroid cartilage, cricoid, and then over the thyroid. It's a little difficult to feel the isthmus, but the trachea, you can feel the rings, and then suddenly it just gets kind of softer there. I also just gently press on one side, and I can feel the thyroid tissue pushing against my other fingers, and then I press with my left hand, and I can feel them on that side. So then with my fingers over the thyroid, I ask the patient, do you mind swallowing? And then I can feel that move underneath my fingers, and she has a normal thyroid without nodules or enlargement. If there's concern about hyperthyroidism, then you want to listen with the diaphragm over each lobe of the thyroid in case there might be a bruit. For lymph node palpation, you want to use your fingertips and generally think of them as all in a chain. So first is the occipital right at the base of the occiput. And then the post-auricular is behind the ear. Pre-auricular is in front. Tonsillar is right below the angle of the jaw. Submandibular is before that, and then submental is right below the chin. The anterior cervical chain goes down in front of the sternocleidomastoid, and the posterior cervical chain goes behind. Supraclavicular nodes are above the clavicle. You should generally not feel anything there. If you do, it's a very concerning sign. The occipital nodes, the postauricular, preauricular often will enlarge with lesions on the scalp, and then the cervical chain, anterior usually with tonsillitis, posterior often with mono. It's not 100%, but those are often the drainage locations for the different infections.
So when I start the exam, I'm just going to take a look at your head. Just going to examine that. You haven't noticed any bumps, any lumps, any drainage of any types, like from welts, nothing like that? No itching?
Nope.
Okay, great. And I'm just going to touch right here. Okay. I'm going to apply some pressure here, and I just want you to tell me if you have any tenderness.
Nope.
What about here?
Nope.
Great. I'm going to put a little bit of pressure here. I just want you to clench your jaw. Good. I'm going to touch you, and I just want you to tell me it feels the same on both sides. The same? The same? Okay, great. And I want you to smile for me real big. Okay, wrinkle your forehead. Frown for me, and puff your cheeks. Good. Just gonna listen right here. And on the other side as well. Great. So now I'm just gonna feel around your eyes, okay? Touch your lacrimal ducts. Just gonna look in your upper and lower lids. You haven't noticed any drainage, any discharge of any kind, have you? No pressure, no pain like that?
Nope.
Okay. Great. So what we're gonna do for this next part is I'm gonna have you hold this card out about 14 inches from your face. You're gonna cover your left eye, and I want you to read the line that you can, the smallest line that you can read, okay? But do you wear glasses or contacts? Okay, great.
LTFPH.
Great, now switch and do the same thing with the other hand.
LTFPH.
Great, now we're gonna do it with both eyes open.
LTFPH.
Good job, thank you. So for the next exam, what we're gonna do is I want you to look directly into my eyes, okay? I'm gonna hold my fingers, I'm gonna wiggle them around the periphery. I just want you to tell me where exactly you can see them if you can, okay?
The top.
Okay.
The top. Bottom. This one. Bottom. Bottom. That one.
Great, thank you. Next I'm gonna take my pen light here, and I want you to look at this, and then look at the, look at my pen light, and look at the wall. Great. So next you're gonna follow my pen light, okay? Thank you. So I'm just shine a bright light into your eye, just look right at my nose. And for this part, I would also dim the lights, okay? I'm gonna shine a bright light into your eyes, okay? Great, just looking at all the eye structures, okay? I'm gonna look at your left eye. Okay, wonderful. No problems with that? Okay, no complaints with your eyes?
Nope.
Okay, great. Next I'm just gonna take a look at your ears. Just gonna inspect them. Feel them. You're not having any pain or any discharge, any trouble hearing, no muffled, nothing like that?
Nope.
Okay, and let's look at this one. So what we're gonna do for this is I'm gonna actually first occlude the left ear, and I'm gonna say a phrase. I want you to read that phrase. Say that phrase back to me, okay?
1, 2, 3, 4, 5, 6.
Great. And we're gonna do the same thing on the other side, okay?
6, 5, 4, 3, 2, 1.
Good job. So now I'm going to take this tuning fork, I'm going to place it on the top of your head, and I just want you to tell me if you can hear it in the left and right, or both, okay?
Both.
Wonderful. Now I'm going to strike the tuning fork again, I'm going to place it behind your ear, and I want you to tell me when you can no longer hear the sound, then I'm going to place it in the front of your ear, and I want you to tell me when you can no longer hear it as well, okay?
Okay. Stop. Stop.
Great. The same with the other side.
Stop. Stop.
Good. And lastly, I'm going to take a look into your ear, okay? Okay, looks nice and clear. You can visually see it, the membrane. Let me change the cap. Wonderful. No problems with that? Okay. So next I'm going to take a look at your nose, okay? I'm just looking at the structure. I'm going to have any tenderness around there. I'm going to shine a bright light into your nose and take a look. You haven't noticed any difficulty breathing, any drainage?
Nope.
Great. What we're going to do next is I'm going to hold something underneath your nose. I want you to close your eyes, and you're going to occlude one air, and I want you to breathe in and tell me if you can, what you smell, okay? You can go ahead and close your eyes and hold your left. What do you smell?
Rubbing alcohol.
Great. Now do the same with the other side. Breathe in.
The same rubbing alcohol.
Okay. And you're not having any difficulty breathing throughout either of them? Okay. Wonderful. So for the next part of the exam, let me just wash my hands again. I'm gonna put some gloves on, okay? I'm gonna take a look into your mouth, okay? Okay. To begin with, I just want you to open your mouth really big for me, and now just keep it open, okay? Say ah and stick your tongue out. Perfect. So I'm gonna take a look into your tonsils. You can stop saying that, it's okay. Just keep your mouth nice and open. Lift your mouth, tongue into the side. Great. I'm just gonna take a look at your teeth. You haven't noticed any pain or ulcers or any drainage of any type, have you? Great. Move your tongue side to side. Okay, and push it to the roof of your mouth and to the bottom. Perfect. Good.
Just want to check your hair. Just looking at your hair, it looks shiny and clean. I don't see any lesions on the scalp. I'm just going to feel your head. I don't feel any lumps or bumps or lesions. Good. Just looking at your eyebrows, your eyelashes are both even, bilaterally. Look, no signs of hair loss. They're full, adequate. Good. Can I have you pull your eyelids down for me? Good. And then lift them up. Wonderful. So your conjunctiva is a healthy pink color, your sclera is white and intact. Looks good. Okay. I'm going to have you follow my finger. Don't move your head, just watch my finger. Don't move your head. Good. Alright, I'm going to come in. Wonderful. Alright, now I'm going to have you look at that clock on the wall, okay? Now look at my finger and look at the clock. And my finger. And the clock. Wonderful. Good. Alright. Have this card here. I want you to cover your left eye and read the smallest line you can read.
63925.
Wonderful. Now cover your other eye. Smallest line you can read.
63925.
Great. Alright. I'm just going to have the lights dimmed just a bit so I can check your pupils. Alright. I want you to look straight ahead at me, okay? Look at the light. Good. Look straight at me. At me. You're fine. Alright. Look straight ahead. Good. Okay. You need to move a little more. Thank you. I'm just going to use this tool to look into your eyes. Yeah. Okay. Look straight ahead for me, okay? Wonderful. And can you look at the light? Good. Look straight ahead for me. Good. And look at the light. Wonderful. All right. Okay, we'll move on to your ears. Okay, I'm just going to inspect the outside of your ears, see, look for any lesions or abnormalities. I don't see anything abnormal, it's just some low piercings. I'm going to go ahead and feel you a little bit. Not feeling any abnormalities. All right. Can I have you plug one of your ears? Good. Now I'm going to whisper a number and I want you to repeat it for me, okay?
Okay. 4.
Good. Plug the other ear. Wonderful.
7.
Good. Okay. Alright, and I just want to take a peek inside your ears, okay?
Okay.
Let me know if I hurt you. Good, and the ear canal looks clear, no foreign bodies. Healthy color. Sorry.
Oh.
Thank you. Alright. And same thing in this ear. Good, and this canal looks the same. Alright. I'm going to circle back to the eyes. I forgot your peripheral vision.
Yes.
So let's do that. Can you see my hands?
Yeah.
Okay, when you see my fingers wiggling, let me know, okay?
Okay. Okay.
Good.
Okay.
Again.
Okay.
One more time.
Okay.
Good. Alright. We got the ears, eyes. Let's go to the nose. Can I have you plug one nostril? And breathe in. Good, and out. Other side. Wonderful. Grab my tool one more time. Should just keep this next to me.
Mm-hmm.
Alright, look up to the ceiling for me. I'm gonna peek up your nose. Good. Good. Alright, looks good. Just keep that there. Alright, have you open and close your jaw for me? 1,
Wonderful. Good. I'm gonna press on your head. If you feel any pain, let me know. Any pain or tenderness?
Nope.
How about here?
Nope.
Wonderful. All right. Let's move on to your mouth. Can you open your mouth for me? Nice and wide. Stick your tongue out. Good. Say ah. Good. Take your tongue to the left, right, and the right. Good. Put it at the roof of your mouth. Wonderful. Can you pull your lip down for me? Good. And then your top lip. Wonderful. Right, now I just want to feel for your cervical nodes. Okay. Your lymph nodes. Go, reach around back here. Wonderful. Let's get your cervical chains, your clavicular. Wonderful. One last thing, I'm going to come around behind you. I'm going to feel for your thyroid. Make sure that that's midline and in the right position, and that your trachea is also midline. Can you swallow? Wonderful. Trachea is midline and everything's in the right position.
So let me see. The hair looks very clean, very smooth. No bald spot. I'm going to palpate your head for any lumps. No lumps. The scalp also looks very clean. Okay, the head, it's normal cephalic. No lumps, no lesions, everything is very smooth. So the next thing, I'm going to be inspecting your face. I'm going to look for symmetry, the ears, the eyebrows, the eye, nose, and mouth. Everything looks symmetrical, and this is part of the cranial nerve number 7. Okay, so I'm going to palpate the temporal artery. Okay, no tenderness. Okay, it doesn't feel hard. I'm going to check now your temporomandibular joint, and I'm going to ask you to, okay, can you open your mouth and close? Okay, open again, close. Okay, no clicks. Do you feel any tenderness when you do that? No tenderness, okay. And yeah, and it looks like no limitation of movement. All right, thank you. Ms. Suarez, so now I'm going to be checking for your sinuses. First, I'm going to palpate in your maxillary. Let me know if you feel any tenderness when I do this. No pain? Okay. And your frontal. Do you feel any pain?
No.
No pain?
No.
Okay, that's good. Okay, so next I'm going to be inspecting for the external ear. Okay. I'm inspecting for the skin. Okay, there are no lumps, no lesions, no redness. The ears are equal size bilaterally. There are no discharge that you could see, and the skin color is actually consistent with the facial skin color. So now I'm going to use my otoscope. I'm going to make sure that I use the largest speculum for the otoscope, and I'm going to be checking your internal ear. Is that okay? All right. So can you tilt your head? There you go. Okay. I'm checking for any redness, any discharge. I'm looking at the tympanic membrane and it looks fairly gray. Do you feel any tenderness? No. Okay. No tenderness. Very good. Thank you. Okay, so next I'm going to be checking now for your hearing acuity. Okay, so basically what I'm gonna be doing, I'm going to occlude this ear now, and I'm gonna be whispering a few words, like short words, and you just have to repeat what I'm saying. Okay, so I'm gonna start with this ear. Is it occluded? Okay.
Mm-hmm. One. Today. Monday.
Okay, that's very good. So I'm gonna repeat the same thing with this ear.
99. 75. 22.
Okay, so that it's normal for hearing acuity. So now I'm gonna be performing the Weber and Renee test. What I'm gonna be doing, so using the tenon fork, so I'm going to do the Weber test. So you're gonna hear some vibrations. I just need you to concentrate and tell me if you can hear the sound equally in both ears, okay? You do?
I guess.
Okay,
Yeah.
let's try it again. Yes.
Yes.
Okay. So now I'm going to be performing the Renee test. Basically you're gonna tell me the same thing. You're gonna hear a vibration and you have to tell me when you not longer hear it, okay? So first I'm gonna place it here in your mastoid, and then I'm gonna just put it in front of your ear, okay? Let me try to get the hair out of the way. There you go. Tell me when you're not. Okay, let's do it again.
Yeah, I know when I know.
Okay, when you no longer hear it, okay? You have to tell me stop.
Listen.
Okay.
No. There's. No.
Okay, so that's checking for air bone conduction, so that it's normal, and we're gonna do the same thing with this ear now. Try to get the hair out of the way. Perfect, thank you.
No. No.
Okay, and that it's also normal. Thank you, Ms. Suarez. All right, so I'm going to check your eyes now, and let me start by asking, do you wear glasses or contact lenses?
No.
No? Okay. So at the beginning of the visit, we did a Snellen chart that was for vision acuity, checking cranial nerve number 2, the optic nerve, and your visual acuity, it's 20/20. But now I'm going to check for the near vision. So what I'm gonna do, I'm gonna ask you to cover one eye. We're gonna do one eye at a time. Okay, don't press too hard. And at a distance like this, you're gonna start reading.
Treasure trove for the one who has it all, a gift to house their most precious
Okay,
piece.
that's good. Cover the other eye now, and we're gonna blink a couple of times. Cover the eye. Okay, hold it. Go ahead and read it.
For the one who has it all, a gift to house their most precious pieces.
Okay, that's good. So as we can see, my patient, she didn't adjust the magazine. She didn't move it closer or further away. So it's basically a 14/14, which is normal for the near vision. So that is good. Now to test for visual, we're gonna do the confrontation test. So I'm just gonna sit over here, basically at the same eye level. I'm gonna try to stay 2 feet away from my patient. I'm gonna ask you to cover one eye. Okay, I'm going to cover the opposite eye. You're gonna be looking at my eye. And then when you see my fingers, you're gonna tell me now, and you're gonna tell me how many fingers you see, okay? Without moving your head.
Now, 2.
Okay,
Now, 2. Now, 2.
okay. Cover the other eye. We're gonna repeat the same process.
Now, 2. Now, 2. 2. Now, 2.
Okay, that's good. Okay, so that is fine. So now I'm just going to examine the external eye, and I'm basically just looking for the shape of your eyes. You're symmetrical for the alignment. Everything looks well. Let me see your conjunctiva. Okay, in the lower lids, they do look a pinkish normal color. The conjunctiva looks clear, the cornea, the sclera, everything looks, the eye and the inside, it looks moist. Everything looks good. And the pupils, they are round, equally round, and the color, just, well, they have brown eyes. So now using my pen light, I'm going to check for perla. So you're gonna be looking at me. Don't move your head, okay? Okay, that's good. All right, so my patient has perla, so pupils equally round, reacting to light and accommodation. That's fine. Now we're going to do we're gonna check the extraocular movement. So don't move your head, you're just gonna follow my pen with your vision, okay?
This is
Okay.
fine.
Okay, very good. And that was checking for cranial nerve number 3, 4, and 6. That was very good. I'm going to do an ophthalmoscopy examination. I'm going to first darken the room, and then with my right hand, I'm going to look into the patient's right eye. Okay, and what I'm doing here, I'm noticing for the orange glow of the pupil, also the red reflex of the retina, and the opacity of interrupting the red reflex. Now with my left hand, I'm gonna look into the patient's left eye, and I'm basically looking for the same thing. Okay, so that's good. Suarez. So now I'm going to check your nose, and I'm just inspecting your nose first. Let me see, do you feel any tenderness?
No.
Any pain?
No.
No? Okay. So the nose looks symmetrical. While I'm using my pen light, I'm also going to take a look. Tilt your head back a little bit. Okay. Everything looks well. No discharge. Everything looks fine. There's no tenderness, no swelling. Okay, while I'm using my otoscope and also with the largest spectrum, I'm going to take a look inside your nose. But first, let me see. So can you push in one of your nostrils, okay, and blow out? And that's, I'm checking for patency. Do it again. Okay, very good. Cover the other nostril. Okay, do the same thing. Blow. Perfect. That's good. All right. Now you're gonna tilt your head back slightly, and using, it may feel a little bit of discomfort. Using my otoscope, I'm going to look inside your nose. Okay.
Okay.
Ready?
Mm-hmm.
Okay. Everything looks good. All right, so that is good. Yeah, everything's fine. I don't see any masses, any swelling, no bumps. There's no discharge. Do you suffer from allergies?
No.
No allergies. Okay. So very good. While I'm checking your nose, I'm going to test for cranial nerve number 1, and this is the olfactory nerve. So I need you to close your eyes. Okay, and I'm going to give you something for you to smell. Make sure that you don't open your eyes, and you just have to identify what I'm giving you.
Okay.
All right, smell.
Cinnamon.
Okay, very good. Keep your eyes closed, and then smell this.
Coffee.
Okay, you can open your eyes now. And so cranial nerve number 1, it's intact, which is fine. All right, so next I'm going to check your mouth. Let me see. The first thing I need to do is I'm going to inspect your lips. Open your mouth. Okay, so the lips, they look moist and hydrated. They look normal pinkish color, normal pigmentation. Let me see. So I'm going to use my pen light to take a look inside of your mouth again, and also the tongue blade. Okay, so I need you to open your mouth for me. Okay, let me just inspect first. Everything looks fine. Do you feel any tenderness in your mouth? No? Okay, so I need you to stick out your tongue. Okay, move it side to side. All right, and up and down. So that is checking for cranial nerve number 12. Can you say tight?
Tight.
And light?
Light.
Okay, and I'm also observing the lingual speech. The patient can speak and she doesn't have to make any effort. She actually makes full sentences. Can you tell me again? Tight?
Tight.
Okay, that's good. Okay, and now open your mouth. I'm going to stick out your tongue one more time for me. Okay, can you say ah?
Ah.
Okay, that's good. And let me also check for the gag reflex. Open your mouth. Okay, thank you.
I'm going to feel your head, and I want you to just let me know if there's anything that is tender. So what I noticed right away is that your head is atraumatic, normocephalic. Your scalp is pink, free of lesions and infestations, and I don't notice any flaking or dryness. Your hair is fine, blonde, with normal female distribution. It's also clean and soft. Noticing your face, symmetric. And your skin is smooth and free of lesions. I'll feel your temporal arteries. Is there any tenderness there?
No.
Fantastic. And then we'll go to your lymph nodes. So I'll start with the occipital nodes, your postauricular, preauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. And all of those are non-palpable. Are they tender at all to you?
No.
Great. I'm going to feel the back of your neck and your cervical vertebrae. Any tenderness there?
No.
Great. And then now I'm going to feel your thyroid. If you would press your head into my hand. And the same on this side. And that feels grossly symmetrical. I don't feel any palpable masses in your neck. And so that's nice and normal. So I'm going to start with an eye exam, and I'll give you instructions as we go along. Let me know if you have any questions. So first I'll notice that your brows and eyelashes are both symmetrical, free of infestations, of crusting. They're not thinning at all. And there's no lesions there. And your lids are both symmetrical, and there's no lid lag, there's no ptosis, there's no swelling or erythema. Noticing your nasal lacrimal ducts, there's no exudate, no erythema. Is there any tenderness for you?
No.
Great. The bulbar conjunctiva are both clear and smooth. Their palpebral conjunctiva are pink and smooth. Your sclera are white, and your cornea is clear. I see no ulcerations or lacerations around your eyes, and the anterior chamber is clear. Can you tell me how many fingers I'm holding up?
3.
Great, so your visual acuity is intact. I'm going to check your visual fields. If you would cover your right eye and let me know when you can see my fingers moving.
Yes. 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 Yes.
Great, and if you would cover your left eye.
Yes. 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 Yes.
Fantastic. All right, and now I'm going to check your extraocular muscles. So if you would, follow my finger. Fantastic. So your extraocular muscles are intact, as well as convergence. All right, so next I'm going to test your corneal light reflex. And your corneal light reflex is intact bilaterally and symmetric. So we'll test the uncover test. If you would, cover your right eye. And I notice tracking in your left eye. Go ahead and uncover your right and cover your left, please. And I notice the tracking in your right eye. And both of those look symmetrical and normal. Next, I'm going to take a look at your pupillary reflex. I notice that your pupils are both equal and round. And both are reactive to light. And I see that both direct and consensual reflexes are intact. Now I'm going to take a look at the blood vessels in your eye. Since I'm using the panoptic, I don't need to turn off the light in here. There we go. All right. So if you'll just take a look at the wall behind me and keep your gaze there as I do the exam. I'm going to find the red reflex, and I've got that. And as I come in, I notice the vessels. I see that there's no nicking. There's about a 2 to 3 ratio there. And I will follow the vessels to the disc and cup, and I see a 1 to 2 ratio there. All right. And we'll do the same thing on this side. I've got your red reflex. And I come in, take a look at those vessels, follow them to the disc and cup, and I see again the 1 to 2 ratio there. So your eyes look fantastic and all normal. Okay. So next we're going to do the ear exam. So I'm going to take a look and also feel. Let me know if there's any tenderness here.
Nope.
And on the tragus?
No.
Mastoid process or the auricle?
No.
Great. And so I noticed that the pinna are symmetrical and level with the outer canthus of the eye. And there are no lesions, swelling, and we already assessed tenderness, so there's no tenderness. Next, I'm going to take a look in your ears. And I notice that the canals are smooth and pink, and free of swelling, discharge, lesions. And I can see that, I can visualize the tympanic membrane and all of the ossicles there, as well as the cone of light. So we'll take a look at this side. And again, the canals are smooth, pink, without debris, discharge, swelling, or lesions, and both tympanic membranes are gray with clear landmarks and a cone of light present. Now I'm going to test your hearing. Will you cover your right ear? And let me know, can you hear this?
Yes.
And let me know when you can no longer hear it.
No.
Okay, great. And would you cover your left ear? Can you hear this?
Yes.
Let me know when you can no longer hear it.
No.
Great. So next I'll do an exam of your nose. And I'm going to switch out my speculums here. Alright, so I'm just going to feel and notice as I do that your nose is symmetrical and midline, free of lesions, any evidence of trauma. And is it tender at all to palpation?
No.
Fantastic. Next I'm going to take a look in your nose. If you would look up slightly. And I notice that they are patent bilaterally, and the septum is in the midline. The nasal mucosa is pale and pink, and I can see the inferior turbinates. There's no swelling or discharge. I'm going to palpate the maxillary sinuses. Is there any tenderness at all there?
No.
How about the frontal sinuses? Any tenderness there? No. Great. And next I am going to transilluminate your sinuses. Great, and that looks normal. Fantastic. And if you would open your mouth, I'll look at the maxillary sinuses. Great, and I can see a glow in there, letting me know that we're able to transilluminate and there's not any sinus infection present. So next I'm going to do an exam of your mouth. I'm noticing right away that your lips are pink and smooth, symmetrical, and free of lesions. Your TMJ, will you go ahead and open and close a few times for me? So great, there's free range of motion there, no crepitus, no swelling that I'm noting. Any tenderness? No. Fantastic. There's no deviation or click. I'm going to take a look inside of your mouth now. If you would open. Alright, the buccal mucosa is clear and pink. The teeth, if you would let me take a look at your teeth on both sides. Fantastic. The gums. And then if you would stick out your tongue all the way, say ah. Ah. I can see the tonsils, the uvula, and the posterior pharynx. So what I noted, oh, and underneath the tongue, fantastic.
First off, her hair appears to be evenly distributed, and it is nice and thick. It does not appear to be brittle at all. It's soft to the touch. It's a brown into blonde balayage, so it's colored at some points, but it's appears to be nice, healthy hair. I'm also going to look for any dandruff. And Brittany, have you noticed any dandruff?
I don't think so.
Okay. Great, so I'm also going to look at her scalp. I'm just going to check the skin, looks for any lumps, bumps, protrusions. So I'm just going to look at your skin, Brittany. I don't see anything so far. Okay. Yeah. I don't see any nevi. I don't see any lesions, any dry patches or redness. The color of her skin, of her hair, appears to be equally distributed throughout her scalp, or rather the color of her skin appears to be equally distributed throughout her scalp. I didn't notice any dry patches or anything like that. I'm also going to look at your face, Brittany, and I see, yeah, other than some freckles and some nevi, I don't see any acne, any pimples whatsoever, any dry patches. Have you had any irritation of your skin or anything like that? Yeah. And the color of her skin appears to be white, equally distributed, consistent throughout. I'm just going to feel your facial bones. Okay. Now I'm just going to look at facial symmetry. Go ahead and smile for me. Great. I see that her expression was equal bilaterally. I don't see any involuntary movements, anything of that nature. What I'm going to do now, Brittany, is palpate your temporal arteries. Okay, and they appear to be a 2+. I don't feel any thrills whatsoever. I'm also going to test your temporomandibular joint, Brittany. And so go ahead and open and close your mouth. Great, great. And facial bones. Yeah, so temporomandibular joint, I didn't hear any clicking whatsoever. It was equal movement bilaterally. Did you have any pain when you open and close your jaw? Awesome. So now I'm going to look at your eyes. I'm going to notice that your eyelids and eyebrows, the hair distribution is equal bilaterally. I don't see any lesions or anything like that. Okay. Your eyes appear to be, the eyelids appear to be pink. They're not irritated, no sign of irritation or redness. I'm going to look at the conjunctiva. Notice that it's clear and that the sclera is white, nice and white. I don't see any yellow, yellowing of the sclera, which would be consistent with jaundice. I also see that your, I'm going to check your lacrimal glands, lacrimal sacs. Did you feel any pain or tenderness when I did that? Okay, I didn't see any discharge or anything coming from tear ducts when I palpated them. I didn't feel any masses. I didn't feel anything out of the ordinary, and it was equal bilaterally. What I'm also going to do is test your confrontation. And so, Brittany, I want you to keep your head straight. And then I want you to tell me when you see my fingers come into your line of vision, okay?
Not there. There. There.
Okay.
There. There. There.
Awesome. So we're doing good there. What I'm going to do next is look for any extraocular movements. And so, Brittany, what I want you to do is keep your head straight and then follow my finger with your eyes only, okay? Okay, and I did not see any extraocular movements whatsoever. The movement of her eyes, was equal bilaterally. And so I didn't see anything there. I'm also going to now just look at the pupil size. I'm going to see we're about a 4 for pupil size, and it's equal bilaterally. What I'm also going to do is just now look at, just shine a light inside your eyes. Okay. Okay, so I noticed that direct reaction, the pupil did constrict, and also consensual reaction for both the pupil did constrict, and that was equal bilaterally. What I am going to do now, Brittany, is have you keep your head straight, and then I want you to follow my finger as I come towards your nose, okay? Awesome, so I did notice that the pupils did constrict to accommodate, and it was equal bilaterally. Now, Brittany, what I'm going to do is just look inside your eyes, maybe a little uncomfortable. Bear with me, it'll only be for just a few minutes, okay? Okay, so I see the red reflex. I see the optic disc is yellowish orange and that it appears to be clear. Open your eyes for me, Brittany. There we go. Clear lines, it's not blurred. I see the vasculature by the optic disc. I also see that the retinal background is free of any lesions. Okay, and I saw the macula as well. I'm going to look in this eye. See the optic disc, clear lines, not blurred. No lesions in the retinal background and the red reflex, the macula, and the vessels. So we're looking good there. Now, Brittany, I'm going to look in your ears. And so I'm going to see with both of your ears, I don't see any discharge. I see the helix, the tragus, but no obvious discharge or anything like that. Brittany, have you noticed any ringing in your ears? Any decreased ability to hear, pain, tenderness in your ears? No. Okay, awesome. No discharge coming from them? Great. So what I'm going to do is I'm going to stand behind you and whisper some words, and I want you to repeat them back to me, okay?
Okay. 3, 2, 1. Light, bright, tight.
Awesome. Great. So she was able to repeat all of the words back to me, which tells me that gross hearing is intact. Now, Brittany, what I'm going to do is I'm going to take this tuning fork, and I am going to put it on top of your head. You're going to look like a Teletubby. And I'm going to have you tell me if you hear conduction equally in both ears, okay?
Okay. Yep.
Okay, awesome. Now what I'm going to do is I'm going to put this tuning fork behind your ear, and you tell me when you stop hearing it, and then in front of your ear and tell me when you stop hearing it, okay?
Okay. Okay. Okay.
Okay.
Okay. Okay.
All right. So the air conduction is greater than bone conduction in both ears bilaterally, which is normal. normal finding and what we want to have happen. So what I'm going to do is I'm now going to look inside both of your ears, okay? Okay, so it'll only take a minute. Maybe slightly uncomfortable though, okay? So I'm going to pull your ear up and back. And I'm gonna look, I see a little bit of cerumen, your tympanic membrane. It's grayish pink. I don't see any fluid buildup behind it. See the cone of light, no thickening of the tympanic membrane, which is good. So I'm gonna look in this other one. Okay, a little bit of cerumen in this one as well. I see the cone of light though, tympanic membrane. It's grayish pink in color as well. No fluid buildup behind the ear drum, and no thickening of the tympanic membrane either. Okay, thank you so much, Brittany. Now what I'm going to do is inspect your nose. I see that the skin color of the nose is consistent with the rest of your face. I don't see any redness or any irritation or anything of that nature. I do see your nose ring on the right there. Brittany, have you had any congestion or drainage coming from your nose? Okay. Anything out of the ordinary? Okay. What I'm going to do is I'm going to just look inside your nose for just a second. Okay. So I'm first going to see that her septum is undeviated, which is good. So I'm just going to look inside your nose. Okay, I see her turbinates are nice pinkish red. And septum does not appear to be ruptured or have any tears or anything. Yep, turbinates pinkish red. And no rupturing or tearing of the septum on that side either. Now I'm just going to feel your sinuses, your sinus passages, and I want you to tell me if you have any tenderness or pain, okay? Okay. Any pain there? Pain there? Okay, great. Good. So no pain, no irritation in that area either. So now what I'm going to do is look at your mouth. I notice first off right out of the gate, your mucous membranes are nice, moist, and intact. Your lips don't appear to have any cracks. They appear moist in nature and they're pink. I'm going to have you open your mouth for me, Brittany. Yep, I'm going to see that teeth are white. I don't see any cracks or any signs of irritation. I also see that there's normal distribution of the teeth. I'm also going to, I don't see any that are missing either. I'm also going to look at your gums. Okay. I'm just going to, sorry. Just going to pull right back here. Okay, so her gums are nice and pink. I don't see any lesions or anything like that. I don't see any yellow discoloration, white patches, anything of that nature. And then, Brittany, I'm going to have you open up your mouth for me. Okay, and I'm going to have you stick out your tongue. Okay, and what I am going to have you do is, hold on one second. What I'm going to have you do is stick out your tongue for me. I'm going to go ahead and swallow for me. So I see the uvula, it's nice and pink, and it's not deviating from one side to another. Brittany, I'm going to initiate your gag reflex, okay? So maybe open up your mouth. Maybe. There we go. All right, so she has a good intact gag reflex. Go ahead and say ah for me. Ah. And there is good movement of the uvula. I see the soft and the hard palate are intact. And so what I am going to do next is just look at your tongue. Stick your tongue out for me again. Move it from side to side. Yep. Left side first. Yep. And the right side. Good. So I see it's nice and vascular. It's pink. I don't see any irritation spots on it. I also don't see any white marks on it either. So now, Brittany, lastly, I'm going to look at your neck. And so I'm just gonna look at your neck here. I see off first glance that I don't see any goiter. Her neck appears to be symmetrical bilaterally. And the skin appears to be consistent with her face and her upper chest. Okay, I do see some nevi again, but I don't see any lesions or any irritation spots or anything like that. So now what I'm going to do is palpate your lymph nodes, preauricular, postauricular, occipital, superficial cervical, and down into your deep cervical chains, okay? And then your posterior clavicle and your supraauricular. And then I'm gonna feel your mandibular, submandibular, and your mental. And I don't feel any of them, which is normal. Don't wanna feel them. Have you felt any pain, any issues whatsoever? Okay, great. So now what I'm going to do is I am going to have you extend your neck up like this, and then flex your neck down. Good. So up and down, and then I want you to move side to side. Like this? Yeah. Great. So she has great movement of the neck. It's uninhibited. I don't see any difficulty with that movement. Brittany, did you have any pain with that whatsoever? Okay, great. So now what I'm going to do is I'm going to palpate your trachea, and then I'm also going to palpate your thyroid. And so to do that, I'm just going to feel the trachea, and it appears to be undeviated. So what I'm also going to do is I am going to feel for your thyroid. So what I want you to do, Brittany, for me, swallow. Good, and I feel good movement of the thyroid gland, was able to palpate it, but didn't feel any masses or nodules noted on it.
So to start, I'm just going to palpate your head and inspect your scalp. Any pain or tenderness as I palpate? No. No? Okay, I'm going to palpate the front, palpate your sinuses. Okay, no tenderness there? Okay, I'm going to feel your temporal arteries here. Good. I'm going to feel your TMJ. Can you open your jaw and close and clench your jaw? Perfect. So we're going to do lymph nodes. You got your preauricular, postauricular. You got your tonsillar, submandibular, and submental. Got occipital in the back here, cervical, supraclavicular. Show your shoulders for me. Good. I'm going to come around the back. I'm inspecting your neck veins, and palpating your trachea. Can you swallow for me? Good. And swallow. Perfect. Okay. I'm going to assess your cranial nerves, and by doing that, I'm just going to have you do a series of facial movements. Can you close your eyes really tight for me? Good. Can you smile, frown, and puff out your cheeks? Good. I'm going to use this Q-tip here. I'm going to have you close your eyes, and you let me know when I'm touching you. Okay?
No. 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 No.
Okay, perfect. I'm going to inspect your eyes. Can you look up for me? Good. And look down. Perfect. I'm going to use this note card. This is a Rosenbaum test. I'm going to have you with both eyes open, hold this arm's length, and read the lowest line possible. Okay. A, B, C, D, E. Perfect. Okay. I'm going to have you look forward, just following my finger. With just your eyes, you're going to follow my finger. Okay, ready? Okay. Now I'm going to wiggle my fingers. I'm going to start behind your head. You just let me know when you're in your peripheral vision. Okay.
No. No. No.
Perfect. I'm going to take my ophthalmoscope. I'm going to look at your pupils, see if they're equal and reactive. Good. Still with the ophthalmoscope, with my right hand and my right eye, I'm going to look into your right eye. All right, with my left hand, with the ophthalmoscope and her left eye, I'm going to look into it. Perfect. All right, so next I'm gonna test your hearing and look into your ears, but I'm gonna start by just palpating. Any tenderness here? No? Okay. I'm gonna have you cover your right ear. Okay. I'm gonna whisper 3 words to you. Just repeat after me what I say. Okay. 1, 2, 3. Okay, the opposite. 1, 2, 3. Perfect. Okay. I'm gonna pretend this is my tuning fork. The first test is the Weber. I'm gonna use a 512 hertz tuning fork. We're going to test for lateralization for the first test. So I'm going to hit it, place it on top of your head, and you're going to let me know if it's equal on both sides.
Okay, yep, I can hear it both sides.
Perfect. I'm going to, with the same tuning fork, I'm going to hit it again. I'm going to put it on the mastoid bone back here. I'm going to ask her if she can hear it first, and then she's going to let me know when she doesn't hear it anymore.
Okay, I don't hear it.
Okay. I'm going to place it next to her ear. Can you still hear it?
Yep, I can still hear it.
Perfect. I'm going to do the same thing on the other side. Do you still hear it?
No.
Okay.
Yep, I can hear that.
Okay, perfect. So now I'm going to look in your ear. Using the otoscope, I'm going to pull her ear up and back and look in. Looks good. Pulling her ear up and back. Perfect. I'm going to look in your nose. You can just look up for me. Good. I'm going to have you open your mouth. Good. Can you say ah? Stick out your tongue and move it. Okay.
I'm going to feel your hair and look at your scalp a little bit. Have you had any problems with your scalp, any dryness or itching?
Nope.
Okay. Now I'm just going to feel your head and palpate it. I'm feeling for any lumps or bumps or abnormalities. Any pain or tenderness anywhere?
No.
Okay. And I'm just going to check your temporal pulses and your temporomandibular joint. Can you open and close your mouth for me? Thank you. One more time. That feels really good. Do you have any pain or cracking or popping with that ever?
No.
Okay. I'm going to check your sinuses. Any pain or pressure?
No.
Okay, good. Okay, Crystal, now I'm going to check your eyes and do your eye exam. First, I'm just going to start with inspection and just make sure that everything looks okay. No signs of crusting on your eyebrows or eyelashes, no redness. Now I'm going to check your sclera. They look nice and white, and I'm going to pull down just a little bit further and look at your conjunctiva, and it looks nice and pink. Looks totally normal. Okay, now I'm just going to check your eyes. Can you look straight ahead? I'm going to check for foreign bodies, for any color differences or anything that's not symmetrical. Everything looks good. I'm going to check your pupil reflex, so if you can just look straight ahead. Okay, and now I'm going to check your pupils for reactiveness. So just go ahead and look straight ahead. Don't look directly at the light, just look straight ahead. Good. Okay. Okay, great. Okay, Crystal, now we're going to go ahead and I'm going to have you do some tests to check your vision. This first one's going to check for visual acuity, so if you could go ahead and take this card and start with your right eye, so cover your left. And then looking at the Snellen chart that's on the wall, would you please read the lowest line that you can read clearly?
F-E-L-O-P-Z-D.
Okay, good. Would you mind switching to your other side and then reading the lowest line you can see with that eye?
E-D-F-C-D-P.
Okay, good. Thank you. Can you go ahead and have a seat back on the bed for me? Now I'm going to check your peripheral vision. I'm going to have to get a little bit close to you. This is called confrontational test. And so what I'm going to do is I'm going to put my arms over your shoulders, and I want you to tell me when you see my fingers moving. And just look straight ahead. Look into my eyes.
No.
Okay?
No. No.
Okay. Okay, good. Okay, this test is going to test your eye muscles. So if you'll just watch my finger and just don't move your head, just watch my finger and follow it with your eyes, okay? Okay, and then just follow my finger all the way into your nose if you can. Okay, great. Crystal, now I'm going to check your eyes with the light. It's called the fundoscopic exam, and I'm going to actually get a little bit close to you, and I'm going to look all the way back into your eyes. So if you can just look straight ahead, that would be great. So right now I'm looking for what's called the red reflex. Okay, good. And now do your other eye. I'm just going to have to adjust this a little bit. Okay. All right, great, thank you. Okay, Crystal, now I'm going to be looking at your ears. And again, I'm going to start with inspection and just look at both of them. Make sure everything looks normal. I don't see any signs of drainage or infection. Does this hurt at all? Okay. Okay, I'm going to check your hearing now. The first test I'm going to do is called the whisper test. So I'm going to go ahead and plug this ear, and I'm going to say a word, and then I want you to say the word if you can hear what I say. Okay?
Baseball.
Okay, good.
99.
Perfect. Okay, this is also a test for hearing. I'm going to place this right back here behind your ear. I want you to tell me when you stop hearing it, okay?
Okay.
Can you hear that?
Yep.
Okay, good. And let's do the other side. Can you hear that?
Mm-hmm.
Okay, this is the last test I'm going to do to check your hearing. It's called the Weaver test. And so I'm going to place this on your head, and I want you to tell me if you hear this better in the right ear, the left ear, or both.
Both.
Okay, great. Okay, all right, I'm going to check your ears now. I'm going to look inside of them with a light. Okay, I'm just checking for any discharge, redness, swelling. Okay. Okay, now Crystal, I'm going to go ahead and take a look at your nose, and I'm just going to inspect it, look for any abnormalities. Can you go ahead and just occlude one of your nares for me? And can you sniff through it? Good. And how about the other one now? Okay, great. I'm going to take a look inside. I'm going to make sure that the mucosa looks nice and pink. Okay. Great. All right, Crystal, now I'm going to check your mouth and your throat. Right now I'm just looking at your lips. I don't see any lesions or any problems with them. Can you go ahead and open your mouth for me? Just grab my light. Okay, can you say ah? Okay, great. I'm going to go ahead and just use this tongue depressor so I can see the back of your throat a little bit better. Okay, go ahead and say ah. And right now I'm just looking at your tonsils, your pillars, and your uvula, which is midline. Sorry. And you have good dentition. Okay, can you lift your tongue up for me? All right, great. Okay, the last thing I'm going to do is just check your neck. So I'm gonna look at it, and I'm just making sure that I don't see any masses or lesions. Everything looks straight and normal. Trachea looks midline. Okay, I'm going to palpate your lymph nodes, okay? Starting here in the preauricular and moving to the postauricular, the tonsillar. Okay, and then the anterior cervical. And the posterior cervical. And then the subclavicular.
Oops.
Okay, and then the occipital. Okay, now I need to just fill your trachea, make sure that it's midline. And that looks good. And then now I'm going to check your thyroid gland. If you could just turn sideways a little bit, I'm going to come from behind you, and I'm just going to find your thyroid here. Okay, and then if you could just go ahead and swallow for me. Okay, and one more time. Okay, thank you. And then the last thing that I need to do, if you can just turn straight, I'm just going to listen to your thyroid gland and make sure that I don't hear any bruits or abnormal sounds. Okay, and thank you so much, Crystal, for being my patient today.
You're welcome.